conversation designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, an interesting beginning to Boomer Life. Hello and welcome to the program here on CIL 650 with Mind Games, getting us into the program and into the conversation about the brain on the program today. It's a real pleasure to welcome back our group from Neurokinetics Clinic in Vancouver. We have three delegation, actually, on the program with us today. Philippe Silvestre is the founder of the clinic. He is a medical doctor with the French Air Force. He is trained in a number of different therapies and categories. And I just learned a few minutes ago that come this September, Philippe will be inducted into the International Academy of Aviation and Space Medicine at a ceremony in Oxford, England. So welcome back to the program. Great to see you. And congratulations on this terrific news. What a wonderful plug for your capable years of work, Philippe.
Totally unexpected.
Well, so much the better then, right?
It's good to be back.
Well, it's nice to have you back. Sonia Dale is the clinic manager at Neurokinetics on Granville Street in Vancouver. Nice to see you again.
Nice to see you as well, Shirley.
Are you having a busy summer? Is it busy this summer?
It is. It is. I like it.
Busy is good, right?
It is. It is.
And the newest member of the delegation is the Director of Liaison and Logistics, J.C. Gordon, makes a debut appearance. Hi, J.C.
Hey, hi, Sterling.
It's nice to have you with us. How long have you been with the firm, and what brought you to Neurokinetics?
Well, I was introduced to Neurokinetics by a former patient that I had and knew from a previous organization that I was involved with. She introduced me to Philippe, and initially when Philippe and I met, we just hit it off and had the same vision for healthcare, had the same vision for helping people, and knew exactly what people required, and we've been working together ever since.
And how long have you been with the firm then?
I joined the firm the 1st of January.
Oh, okay, the new guy.
The new guy in the black.
Well, perhaps with a little indulgence from you, Philippe and Sonia, I would like to ask the new guy, just for a change of pace, what is Neurokinetics all about?
Neurokinetics is all about optimizing the brain.
Okay.
Sterling, since I have been at Neurokinetics, I have seen miracles with patients. People who had given up on ever getting better, coming in, going through the initial assessment, finding out, first of all, that what Dr. Philippe does, what Neurokinetics does, is going to be able to help them, and from there, put them on their individual treatment program, and literally, on a day-by-day basis, watched people miraculously get better when they had no previous hope whatsoever.
And Dr. Philippe, for these people that JC are referring to that come to Neurokinetics, do all the people have some form of brain issue? Is that why they come to Neurokinetics?
Well, they don't come for that because they don't know they have this type of issue.
Okay.
They come because they cannot function. They come because they are in pain. They come because they cannot stand properly, or they are fall prone, and they are usually in a very difficult emotional state and totally disoriented.
Right. Now, Sonia, you're the person on the front lines at Neurokinetics. You take a lot of phone calls from a lot of curious people and a lot of really frustrated people. Give us a typical, if there is such a thing, give us an example of a typical phone call, falling in behind what JC and Philippe have already talked to in terms, what would a person who is distressed, who has been frustrated by conventional medicine's inability to make him or her any better, what do they say to you when they call you up?
There's a lot of frustration, a lot of stress, a lot of fogginess is what they tell me. They're unclear. They have a lot of burden that's been going on. Some of them have been through several other doctors who have either, just said, here's bunch of medications. You need something for sleeping. Well, here's a sleeping pill.
Right.
You need something for stress. Well, here's a stress pill. Along those things. So they come in and they just say, okay, well, could you kindly just let me know, are you going to give me something else to eat? You know, are you going to provide me another medication, or are you going to, you know, look at the situation and say, this is what we're looking at, and there's another way or another path for you to take.
Right.
It's just providing them the clarity. So initially with the first, I would say 30 minutes to 45 minutes, just speaking to them, you can hear the relief in their voice. You can hear the happiness or the joyfulness that someone is actually sitting there and listening to them and understanding that, hey, yes, there is help. We can help you. Come on in. We're willing to listen to you for 30 minutes, 45 minutes to an hour just to understand what you're going through.
Sure.
Before we even go through the assessment process.
Okay. Now, Philippe, you said moments ago when I asked you, do people who come to neurokinetics, is the common denominator some form of brain issue? And you said not necessarily, because in many cases people don't know they have a brain issue. They're just really uncomfortable and miserable and have been in many cases for a good long time.
Yes.
So how do you clarify to, or how do you help people even to understand what the heck's wrong with them? Because as Sonia just said, many of them have been to many doctors.
Yeah. It is a big deal of information and education with respect to matters that are not currently shared by physicians with their patients.
Okay.
Yeah. In addition of that, my background allows me to blend Eastern and Western medicines with brain-related neurosciences, and it gives me an interesting platform to share paradigms and parameters which are not even understood in a I would say in a mainstream medical community.
Okay. And JC, people come to neurokinetics not only from all over British Columbia and not only from all over Canada, but from all over the world, for crying out loud.
Literally. That is 100% accurate, Sterling. Neurokinetics, basically, with the amount of patients that we have here, would qualify us as a destination clinic. And what I mean by that is we have more than 50% of our patients not from British Columbia and not from Vancouver.
Right.
They have been referred to us from other parts of the world. We just recently had a 16-year-old student who had a terrible accident in her drama class where she was in a back-to-back situation. It was a trust exercise, and her partner was a 350-pound student who literally fell on her. And for over a year, she had suffered with going from local clinics, local specialists. She even went as far as going to premier clinics in the United States with absolutely no results whatsoever.
Right.
She was referred in to us from an ex-former patient of neurokinetics. And this is one of those miracles that I was talking about. When I first saw her, she was barely able to walk. She was all crippled up. And after a 3 to 4 month time period with us, where Dr. Philippe performed his services, and did the work that he does, she has left us. She's gone back home. She now has her life back. She can walk. She's happy. She's a student again. She's enjoying life. And that's what happens at the neurokinetics clinic.
Interesting. And we're going to focus, Dr. Philippe, on this program specifically on matters dealing with balance and dizziness. But as you and JC have already mentioned, and Sonia too, with talking about the phone calls, many people who have these types of injuries are literally incapacitated. They can't fend for themselves. They are so wounded, whether it's psychologically or physically, they are physically incapacitated. This is typical too, isn't it?
It is 100% of this type of patients. Yeah.
So why? Why does that incapacitation result so predictably, Philippe, from these trauma?
I will not be technical in this time, but in short, balance control relates to the vestibular system, which is one of the key tuners in the brain as far as the brain controls are concerned, and allows us to be calibrated and tuned with terrestrial gravity, with the sense of verticality, and coordination, in short.
Okay. And that's all what we typically non-medical types would call the inner ear issue, right? Yes. That's where balance occurs in most of us, right?
Yeah. And the problem is the typical medical approach to this type of issue remains focused on the inner ear, as you just said,
right.
Sterling. The reality is it's much more than that. And for example, a balance control issue, a balance disorder, as people say, will never be alone. We have a host of other symptoms which has to be hunted down and identified into patterns, magnitudes, and synergistic combination that will make up the condition actually the patient lives with. It's much more than a balance problem. It is a lot of things.
What typically, Dr. Philippe, would begin a person on this journey of incredible discomfort with balance issues? What triggers this slide into needing some pretty specific help?
It would be different things. The bottom line, it ties with a traumatic event. Trauma being here defined as anything that will overwhelm brain controls or coping capabilities. It could be a medication. It could be food poisoning. It could be a physical trauma. It could be an emotional trauma. It could be also intellectual burnout. Corporate executives,
sure,
for example,
just stress burnout, right?
Type of thing. It could be a lot of things. Yeah.
So when your equilibrium is off, and whether it's been put off by, as you were suggesting, Dr. Philippe, whether it's executive burnout or just a physical malady or the wrong prescription in some cases can set you off into ways that you were even surprised by. So when individuals call up Neurokinetics and speak to Sonia and arrange to come in for an assessment, how long does it take you to identify the nature of the brain issue before you can even map out a treatment program?
The first session of our assessment protocol of 3 steps will be enough to identify exactly where the problem comes from, which is we need 3 to 4 hours of investigation.
Okay, and before we get into a description of the process, and Sonia, that's really your specialty,
yes,
and
it
JC,
is.
you've been through it too. But I wanted to just talk in terms of general terms about the whole dizziness and balance and the resulting incapacitation. We refer to it, again, we non-medical civilians refer to a lot of that as vertigo. We have difficulty with heights. You lean over, and it's just, or dizziness, general dizziness. How much more specific do we need to be before we go, maybe we should go see a professional and get some help here?
Okay. Balance disorders covered several modalities or several conditions,
Okay.
As people say. Vertigo is one of them.
All right.
It is not the only one. One can be unsteady without having a vertigo. A vertigo is defined by feeling the surroundings spinning around clockwise or counterclockwise, while internally you feel okay. Sometimes it is a complex vertigo which combines feeling spinning inside, internally, and in the same time a conflicting spin outside. That's the worst condition and is seen in syndromes explained like the Meniere syndrome, for example, which is not considered as treatable in medicine. And we actually are able to resolve that type of condition. The other modalities covered unsteadiness, as I mentioned, and also postural weakness, which leads to balance disorders without being a vertigo, without being unsteadiness.
What is postural weakness? What is
Postural weakness is extreme fatigue, extreme weakness, which affect the locomotor system, and that is typically the result of a loss of sensory motor controls, which are located in the brain.
In the brain. Now, I'm looking for root causes here. When one shows up with these symptoms, what typically would be, now you've identified perhaps it was a traumatic, an accident may have triggered something like this. Is the root cause terribly important to you in terms of defining the proper therapy?
Yes. Yes, we need to understand and tie the dot, to understand the history, the chronology of events that have been leading this patient in a particular place.
Right.
That patient is in when he comes to us, he or she. It is important to understand the compounding of effects, adverse in particular, that will end up in incapacitating brain controls.
Oh, okay.
In their governance over physical balance control, or emotional and or cognitive balance.
So once you start down this path, it's pretty easy for factors to pile on top of each other and make things even worse.
Yes. And our protocol is actually geared up to this screening and dismantle this patchwork.
Okay.
Yeah.
We'll find out lots more about neurokinetics, which, by the way, is in Vancouver in the Highcroft Medical Center building. That's right there at Granville and 16th. The address, the proper address, if you will, is Suite 60 at 3195 Granville Street. You might want to just check out the website, too. It's neurokinetics.com, NeuroKinetics. It's a biggie, neurokinetics.com. Excellent website. Have a look while we take this quick break on Boomer Life.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIAL 650. We're back. This is Boomer Life on CIAL 650.
Good song.
And there we were just talking about vertigo moments ago, and our producer, boy, is he fast.
He's
Dwayne
good.
Bishop
He's good.
found U2's Vertigo to throw into the mix
All
today.
right.
As we carry on here on Boomer Life on CIAL 650 with our friends from Neurokinetics Clinic in Vancouver. Its founder and president is Philippe Souvestre. Sonia Dale is the clinic manager. J.C. Gordon is director of liaison and logistics. All three in studio today. And the conversation today is largely about balance, dizziness issues, which, as we've already found out from Dr. Philippe, it's all brain related. All of these, the balance and the dizziness, Philippe, are essentially symptoms of something far more serious, correct?
Yes, totally correct.
Okay.
Yeah.
So if one, now Sonia, you've already told us that when people call neurokinetics, it is for many a discovery at precisely the right time, because they've been around the block more times than they'd care to count in many cases, just getting prescriptions and sort of cursory attention and not really addressing the problem. So they finally get to you, and there's an opportunity to talk to someone who is willing to listen and believe whatever. And Philippe, you were talking about your ability over the years. You've taken your traditional European Western medical background and integrated it with a lot of the better parts of the Eastern medical regime to create a new school of thought in which people from all over the world clearly have seen works for them, and they come to Vancouver to your clinic. So talk to us about some of the people and some of the trips that they've been on. In other words, just following up on what Sonia says, the lack of attention, proper attention from maybe more orthodox medical types have created a situation where a person who was experiencing some brain trauma manifesting itself as dizziness is just literally getting worse by the week. So talk to us about what they haven't received versus what you offer.
Okay. Before, thank you for this question. It is a complicated question in a sense. There's lots to say about that.
Yeah.
First of all, I would say that most of the balance disorders and dizziness conditions dealt with mainstream medicine are properly resolved.
Okay.
We only face those who are not resolved. So it doesn't mean all the balance controls disorders and dizziness issues on a chronic fashion are not dealt with Western medicine. They are in a majority. Now, there is a number of types of conditions which are off the scope of this Western mainstream medicine.
Okay.
This is important to say.
Mm-hmm.
So
while Western medicine is capable of addressing some of these issues,
it works very well.
It lacks for others.
Exactly.
Okay.
Yeah. So it is only about a minority of balance disorders conditions which are not well handled in Western medicine.
Okay.
I have become able to understand that and learn about this particular paradigm, which is a paradigm shift as far as brain physiology is concerned, that can explain why the current medical mainstream approach in Western medicine cannot help.
Okay.
What I know, I didn't learn what I know in medical school. It came after I left medical school through a particular combination of Eastern medical training, Western medical training, and also the work, my studies towards a PhD in cognitive and behavioral neuroscience.
All right.
So it is a mix of all of these three disciplines which have allowed me to come to understand what wouldn't be understandable when I was just a Western medical doctor.
Okay, all right. And so those patients who are capable of being well served by typical or traditional Western medicine usually are. Yeah. But then there are those whose case, whose condition, whose circumstances simply are not accommodated by traditional Western medicine, and this JC, for example, is the typical patient at Neurokinetics, the one who's a little outside the traditional remedy route.
Absolutely, Sterling. If I could sum it up, I would say it this way: the easier cases or the simpler cases are able to be handled through the traditional Western medical model that we're aware of.
Right.
But what we see on a daily basis, Sterling, is that's not everybody. Mm-hmm. There are still people that are out there that are having the problems, that are having the balance disorders. We just had recently we just had an 89-year-old lady come to see us who in the past 3 years had started falling, was starting to have dizziness problems. She encountered in the existing Western medical model that there was no help for her simply because of in her case, that she was going to have to live with it. She was going to have to live with the falls because of her age.
I was just going to say, you're old and old people fall down, so deal with it. Next.
Deal with it. And she's come to see us. We went through the initial evaluations. We're now into the therapy component of it. And after the first session, she is feeling improvements. Why, Sterling? Because at Neurokinetics, what we're doing is we're finding out that the root causes for a lot of these symptoms, certainly dizziness and falling, lies in the dysfunction of the brain, which is the specialty of Dr. Philippe.
Right. Philippe, how do people find Neurokinetics? Obviously, we're doing our best to spread the word today. People come from all over the world to seek your assistance. How do they know about you?
Well, this is a question I don't have the answer. I don't know, quite frankly. When I was in France, when I began my career, I was in the military, and just results caused calls for more results.
Right.
That was in the military, you don't advertise what you do in
True.
medicine.
Yeah.
You just belong to a hierarchy, you're a part of a system, you're a part of a corps, and you are sent patients. You don't have any, who even don't have much choice. They are just sent to you because you're the unit's doc.
Sure.
In particular things. I was dealing with combat pilot units, and when things happen in flight in difficult conditions, one of the most common symptoms is disorientation in space, or spatial disorientation, balance disorders, dizziness, disconnect with environment or disconnect with internal things, and whether physical or mental. And that is also emphasized and magnified by fatigue. So fatigue.
And all of this, of course, for your pilot patients would be happening at 1,000 miles an hour.
Yes, some sort.
Yes, exactly.
Yes.
So, which makes it even more serious.
And those patients, because of the nature of their work, are extremely sensitive to drugs. If you give a drug to a pilot, you will ground that gentleman or that lady for 2 or 3 weeks.
Yes.
Considering the nature of their work. So it is, I made the decision rather to look for drug-less, non-invasive ways to understand and assess and treat this type of disorder.
So there was an interesting challenge that you as a medical, a flight surgeon with the French Air Force were faced, because you had people suffering from dizziness and other brain-related issues, but you couldn't prescribe for them because they needed to fly. And if you prescribed them, they would be grounded. So what a challenge, what a great position to be in to innovate.
Yeah, it was a place of creativity for sure. It was difficult because you are also restricted by the model you work with.
Sure.
You're a part of a system and a core. You don't do what you want. But because of my particular trainings in Eastern medicine combined with Western medicine, I was allowed to use techniques as long as they would be shown working, and they did. So I had many times, the satisfaction to see that my pilots were back in the cockpit 2 or 3 weeks before the others, and that was a profound gratification.
But a therapy and recovery program that had very little to do with drugs at all.
There were nothing to do with drugs.
Ah, okay. We're going to find out how that works. Sonia, let me ask you the same question. How do people find neurokinetics? You talk to a lot of people who call the clinic for the first time. Do you ever ask them, so how did you hear about us?
I do.
Okay. Well, what do they tell you?
A lot of it's, honestly, it's word of mouth. Former patients, they know they're a friend of a friend who, has come to hear from us. A lot of them just look up, simple way of internet.
Just do a Google search.
Just do a Google search.
Sure.
They put in a certain word, whether it's concussion, whether it's pain, whether it's anything, dizziness,
right,
balance.
Right.
Put in anything, and then up comes certain clinics. There we are, neurokinetics clinic. But mainly it is through word of mouth currently right now. They know a friend of a friend, or they have a family member that has formerly come and seen us before. They know that, yes, this person was seen here for this condition. They were helped in this amount of time. I should go in and see them now.
Right.
Yes.
Okay. And JC?
I'll tell you, I have never been involved in an organization, Sterling, that receives referrals from NASA and the U.S. Navy like I have been since I've been at Neurokinetics.
Oh, okay.
The referrals come from everywhere.
Okay.
From doctors, from former patients, from law firms as well, and from high military organizations as well.
Well, this allows me to stroke Philippe just one more time with this new honor. It's an honor. I mean, really, Philippe, you must feel terrific about it. An induction into the International Academy of Aviation and Space Medicine, and working as JC does with patients referred to you by NASA and other aerospace connections. So what a tremendous honor for you this fall in September.
It is a great privilege and honor.
Indeed.
Yeah.
So talk to us a little bit, if you would, about the process. Now we've hopefully encouraged someone listening to us who maybe either is dealing with one of these brain or dizziness or disorientation spells or in their life, or is related to someone, or is a good friend of someone. And Sonia, as they tell you on the phone, I've been to Dr. A, B, C, and they go halfway through the alphabet sometimes and go, and I still don't feel any better. So you bring them in, you encourage them to come in and go through the process. So what is the Neurokinetics Clinic process?
It starts off with a simple phone call or an email. Some cases, I know someone doesn't like to call in. The comfort level of calling in and speaking to someone, so they're most welcome to even send us an email inquiry.
Sure.
So we respond back to either or format, whatever they do send us in. From there, we go ahead and start weeding out or listing out the conditions or the symptoms that they're feeling. For how long, what are the symptoms, who have they previously seen before,
right.
Currently medications they are taking. So we go through a lot of several steps over the phone or through email.
So you work up a bit of a sort of a beginner personal profile.
Yes.
Okay.
So kind of to start off and say, okay, this is what we're dealing with, and then we lead on to what's the consultation process, where we actually invite them to our clinic so they can meet the rest of our staff. They can meet Dr. Philippe and see what I say is the comfort level, if it's there for them. I mean, they're going to be spending a lot of their time with Dr. Philippe, so we want to make sure they're comfortable.
Sure.
Go ahead to move on to the treatment process. So they come in and they sit and dedicate about 30 minutes to 45 minutes of their time, and we go ahead and explain what we can do for them based on the symptoms or information that they provide us
in that email or phone.
Yes, or
icebreaker.
Yes, or the one-on-one consultation time period.
Okay.
And then from there we go ahead after that session, once they want to move on, which goes on to the assessment process.
Okay.
There's 3 of them. So we start with the level 1, which would start on a certain day, so of the week, and then we would go on to a level 2, and then to a level 3. After the level 3 is when the customized treatment program is then made for the patient, which then starts their treatment program from there on forth.
So the 3 assessment sessions, Philippe, are they typically the same for all patients who go through the same series of steps, or do you alter the assessment to suit the individual in your office at the moment?
This is a good question, and that would be the second option. It
Okay.
is we call that as far as the assessment is concerned, and the treatment as well is follow that line. It is a semi-customized pattern.
Okay.
We have a fixed pattern we cannot go away from, as we would miss a lot of things. But on the top of that, we have also some flexibility that will, and that's where in that I call it semi-customized, will be fitting the exact adequation between the assessment needs and the patient's condition.
And in that first of the 3 assessment periods, and I know from previous conversations with you, one of the tests that you conduct is a balance test, isn't it?
It is. It is definitely part of the investigation.
So does everyone who has some kind of brain issue, and we're specifically focusing on balance and dizziness here, but Dr. Philippe, does everyone who has some kind of brain issue have, therefore, corresponding balance issues?
Yes, to some extent, balance disorders are extremely frequent. They may not be strong, but in some case, which is a good thing. But when we screen out and we look for them, if there is a connection with a chronic condition, we'll find out always some sort of balance disorders and dizziness related symptoms
in the evaluation
during the evaluation.
Okay, we'll talk more about this. It's quite a process, and it's as Dr. Philippe has just said, it's semi-customized. There are a required series of tests in order for a certain knowledge base to be achieved, but of course in the process that the testing will be customized to the individual in the room at the time. Our guest from Neurokinetic, it's quite the delegation we have in the studio here on Boomer Life. It's quite a busy spot, you know. The coffee people are going crazy around here. Dr. Philippe Silvestre, Sonia Dale, and J.C. Gordon, all from Neurokinetics Clinic in Vancouver at 3195 Granville Street, right there in the Highcroft building at Granville and 16th, and online at neurokinetics.com. We'll take a quick break and come right back at you here on Boomer Life.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650. We're back. This is Boomer Life on CIL 650.
Spinning round and round. Oh my gosh, it's Boomer Life on CIL 650 with the Dizzy Doctor. We're talking, of course, with our friends from Neurokinetics Clinic in Vancouver. Doctor is Philippe Silvestre. Sonia Dale is the clinic manager. J.C. Gordon is with us for the first time. J.C. is Director of Liaison and Logistics. Dr. Philippe, we were talking about, we're talking on this episode of Boomer Life, a lot about balance and dizziness issues. And you mentioned during our little time out here, and we're going to go back to Sonia's explanation of the process, the intake process, but you also mentioned something about a timeline. That a person, because we've identified the fact that through JC's help and others, that neurokinetics is for many almost a clinic of last resort. They've been to everywhere else. They've received very limited satisfaction, and they're just frustrated beyond belief. They find neurokinetics, and they get something done. So, but Philippe, you talked about a timeline. If someone is dealing with dizziness and balance issues, disorders, how long a timeline are we talking about before someone really needs to do something important?
I would say 6 months.
6 months of what? 6 months of recognizing this imbalance in your life?
No, it's more about doing whatever can be done according to the mainstream mindset.
Oh,
medical mindset. I mean, whether with using Western medical competencies or expertises or Eastern medical expertises.
Oh, I see.
Yeah.
So after 6 months
of trying somebody's remedy, if this doesn't work, there is no significant results. And by significant results, I mean on a scale from 0 to 10, where 0 would be normal, and 10 normal or excellent, and 10 being you cannot hang even holding on the wall and you fall each time you move a finger.
Right.
That would be the 10. then norms would be between 0 and 2,
Right.
Yeah.
Okay. So back to the process, because this is intriguing. Philippe, you were talking about some of the testing that gets done. And there were 3 after the initial come on in and have a chat with us meeting that Sonia, you talked about earlier. Then they come in for the first of 3 assessments. And those assessments, each session can take hours in some cases, right?
They can, yes. They can take up to about 4 hours.
Okay.
Yes.
And Philippe, you've already identified a balance test as being an integral part of the first of the 3 sessions. What other testing, sort of standard testing, do you conduct, particularly in that first session?
Okay. Our assessment includes 2 components, to keep it simple, 2 components. The first component would be investigative, which means it is about talking, conversing, discussing about the patient's history, whether medical, whether trauma history,
Right.
Lifestyle history, occupational history, and so forth, and also reviewing the current status of symptoms and incapacitation, and as well, and medication to be taken at a time, if any. And the other component will be to assess this patient in a sensory deprived environment, which is a specialized calibrated environment in which we can read at once a formidable amount of data which are recorded and measurable.
So you put a person in some kind of isolation chamber of some kind and wire them up? Is that how it goes?
Yes, we don't electrocute our patients.
Darn sporting of you, Doc.
No, we care for them, so we won't ever do that. But we lightly wire them.
Right.
We certainly film them, take pictures from any angle we can, and the process lasts from 45 minutes to 1 hour.
Okay. And that's in the first of the 3 assessment moments, right?
Not only, we repeat this pattern during the 3 sessions. So as Sonia mentioned, the minimum time of such assessment, including both components, I mentioned investigation and measurement,
Right.
Collection, would take about 4 to 5 hours. So I need to spend a minimum of 12 to 15 hours with a given patient, plus personal time, let's say about 1 hour on the top, 1 to 1.5 hour on the top of every session. So that means 3 times 1.5 hour max. You name it, it's 4.5 hours. So it will take about 18 to 20 hours of work before I dare beginning a treatment program, which is nothing else than a treatment strategy.
Okay, so after roughly 20 hours of examination and preparation, then you are prepared to design a strategy for that person.
I know what to do. Exactly.
Okay.
And I will know the outcome before starting the treatment.
Okay. And does the patient get included in these conversations all the way?
100%.
Okay. JC, you want to jump in on this one?
Yeah, the initial assessment that we do, Sterling, with every patient that comes to see us is to determine if what our specialty does is going to be able to help them.
Sure, of course.
And after we've determined that, we then are able to measure the intensity of the program that would be required and the duration of the program that would be required. So before Dr. Philippe begins any treatment, we know, A, we can help, B, what the intensity of our involvement will be, and C, the duration of the involvement.
Right, okay.
So before any treatment is done, our patients know exactly what is going to be coming at them and what is going to be the results.
And I would like to complete, thank you, Jesse, for mentioning that. The most important parameter I rely on before initiating a treatment is I need to know to which extent the outcome will be. I will never start a treatment program if I don't know we got at least a significant amount of recovery.
Okay.
And I know that before starting the treatment.
Okay.
Yeah.
Sonia, you mentioned something a few moments ago about the necessity for the three times process and the evaluation intake.
Yes.
And you said it has to do with the human brain and its ability to retain information. Tell us about that.
Well, a lot of patients, when they do call in, they said, why you guys always do 3? The best way that I can explain to them, I would say, is you can, simple thing as even driving. If you're driving a certain direction, you can train your brain, and it'll remember certain things. This is where I was for a certain amount of time. But if we have, or if we're not well, there is a time where you won't remember. So there's a reason why we do 3. We do the first one, you're going to get the results that we need to get from that person because, A, they're not well and they've come in the first time. Second time around, your brain will remember and said, hey, I've done this before. I just did it yesterday. No problem.
Right.
Third time, you're going to go back to the first day information and maybe if not even worse because, the whole information we need to collect from all 3 of them, collect the data and say, this is what the customized program is. This is why we do 3 of them because you can train your brain a certain way,
right?
But you can't confuse it or train it, repeatedly at a time if you're not well.
Ah, okay. That's a very interesting dynamic
Yeah.
at play there. I feel if you wanted to jump in too.
Sonia has just hit the nail on the head.
Okay.
Thank you.
Ways. I would like to add just a little things as seen from my standpoint. We need one session only performed at any time would be seen as a snapshot on a condition.
Right.
We have this expertise is a result of many studies. You guessed that. It is. I am in my 34 years of career in that business. So when I began to be involved and understood the need to develop such expertise for extremely severe chronic conditions and trauma conditions, I understood very quickly that cognition is extremely volatile in a chronic condition as well as a severe trauma, post-traumatic condition. And because of that extreme volatility, which is instability in the cognitive processing,
right,
one session, one assessment only will not lead to any conclusive information.
Right.
We need 3. We have tried up to 12 repeated sessions.
Interesting.
It boiled down that 3 are enough. It is the effective minimum number of sessions we require to come up with reliable interpretative data, which will give us help us to foresee and forecast a potential degree of recovery available at a given time in a given condition.
JC described when you've reached your conclusions after the assessment process has been completed, and you sit down with the patient and you discuss. Okay, so I've designed this program for you, and it's going to require your being here and participating to this extent. Obviously, you need to get the cooperation of the patient.
100%.
Typically, though, Philippe, how long and I don't suppose there is a typical scenario, but how long might one expect to be in treatment for something that they've probably been suffering from for a good long time?
Yes, sometimes for decades.
Yes.
It is not uncommon to have patients who have gone through this lingering condition for 1, 2, or 3 decades. It is not uncommon. And this is the type of patient we receive. To answer your question in short, there's a minimum duration of treatment which can be extended as needed and according to the complexity of a given condition.
So what would the minimum then be?
12 weeks.
Oh, okay.
This is a paradigm which has been now published upon increasingly over the past 4 to 5 years. It's really recent. I have identified these paradigms 28 years ago. And this is a part of the characteristic of such a treatment program. 12 weeks minimum relates to brain physiology. It is a brain physiology paradigm. It ties with the cognitive controls as they work and support the sensory motor control. So it is hardcore neuroscience.
Right. So in that 12-week period, how frequently would a patient or should a patient expect to go to neurokinetics for those treatment sessions?
It is highly variable. As the common pattern I can describe in simple words is the leverage of the healing momentum which we look for will require a high number of stimulation at the beginning of the program.
Oh, so more up front than as you go along.
Exactly.
Okay.
And the number of sessions will go decrescendo as we go through the program, following the recovery and the recuperation of capabilities from the patient standpoint.
And do some patients require or request, perhaps, an ongoing sort of maintenance program where once every 3 or 6 or 12 months they come in for a visit and a kind of an upgrade, if you will, or maybe just a little morale booster?
Yes. The short answer is yes. This is highly variable. It is people's choice in the first place.
Of course, yeah.
Or sometimes they feel good enough and they won't have the desire or the need to come to see us. Sometimes some patients will come for a tune-up, as we call it.
A tune-up, exactly, right.
And also we use a number of ambulatory stimulations. Patients carry on with them. And the further extent of the lifespan of one of the stimulations is at most 1 year. So some patients will come every year to be tested to see if they still need such a stimulation, and if they do, they will opt for taking it or not.
There's some that do, going back to what Dr. Philippe is saying, there's some that just come in, as you're saying, 6 months or a year, just come in to say, to enhance their performance, as we call it.
Just checking in.
Just checking in, hey, tune up, as he's saying, just to enhance the performance, just to get them back to, or give them an extra little bit of a kick back to, their life. So
a number of corporate executive and professional athletes are coming regularly for enhancing their performance. You can consider, we are as Jesse explained at the beginning of this hour, we are in a peak performance business. So it's not only about recovering and resetting brain and recovering capabilities and potentials. It is also tuning in and enhancing these potentials even once healthy.
JC?
When our patients, Dr. Philippe has completed the treatment program, we always make sure that our patients have ongoing support away from the clinic 24/7 with some of our proprietary protocols that we leave with patients, so that when we get our patients back to their optimum peak performance, that's not the end of the work that we do with them.
Right.
We are with them on an ongoing basis even after they leave the clinic.
Right. Interesting stuff. And good a model, too, a good therapy model as well. So, I need to take a break. Our producer is having a kitten in the next room, so we better put him out of his misery here. When we come back, you've heard, of course, about the mission to Mars. Have you received your invitation yet? Well, guess what? One of our guests has. We'll tell you all about it after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIAL 650. We're back. This is Boomer Life on CIAL 650.
You were always on my mind. You were always on my mind.
Always on my mind. A little Elvis music on Boomer Life this time around. Sterling Fox in studio with friends from Neurokinetics Clinic in Vancouver. The founder and president is Philippe Souvestre. J.C. Gordon is director of liaison and logistics. And the boss, the one who runs the show down there, is Sonia Dale, the
I like
clinic
that.
manager. Likes that part a whole lot. Now, I mentioned the mission to Mars a few minutes ago. This is a big deal for a lot of people, and it's a really big deal for one of our guests. Dr. Philippe Souvestre has, in fact, received an invitation. Now, it's all about the mission to Mars, but there's the Moon Medical Station that's going to be developed in advance of the Mars mission. And somehow or another, it's going to have to do with the International Space Station, which, of course, is already up and revolving around the Earth. So tell us more about what this is all about, Philippe. And it's all about, because of your work with all over the years in developing these interesting new modalities for injuries and trauma.
Yes. This is very, very, very recent. Last week, actually, I was contacted by Mars Society and a consortium of space-focused organizations and agencies to join them into an effort to combine a biomedical hospital that will be the first unit on the moon leaping towards Mars.
Okay, so that's how they envision this whole thing. First, you build a hospital on the moon, which in it of itself would be kind of a challenge, given the light sort of gravity that the moon deals with, and then eventually that that science, that new whatever we learn on the moon, could then, one would hope, be applied in a Martian context.
And anywhere else.
I suppose, and anywhere else, yeah. So, with respect to this moon medical station, what's the timeline, Philippe?
I cannot say. It is a complex operations. The timeline I can share with you is that next year we'll spend over a month in the Himalayas, Everest in particular, to begin to test to the fire of altitude and relative microgravity.
So the experiment begins literally at the top of the world in the Himalayas, experiencing very thin air and that very light environment.
You are trying to get away. We are trying to get away as far as possible from the sea level. Yes.
Wow. So, JC, I mean, I know that you're the logistics and liaison guy, and I know Sonia is a heck of a clinic manager, but what are you guys going to do when Philippe is off up on Mount Everest somewhere trying to learn how to live on the moon?
Well, we're taking pre-booked times from Martians now to have them come and see us in the clinic, and I'm sure that all the photographers and newspapers and outlets will be on top of it. But Sterling, I think it's important for our listeners to know that the caliber of the work that we do at Neurokinetics has been selected in lunar, in Mars-type missions. Why? Simply because of the success that we have for our patients,
right.
Because we're dealing with the root cause,
right.
Which is optimizing the brain,
right.
Dealing with the hardcore cases that the Western and Eastern medical models can't handle. And it is because of the success that we have and the work that we do that these space organizations are looking at Dr. Philippe and the neurokinetics model to be used elsewhere.
Right.
Among other expertise.
Are there, because of this, and because of the attention that's being drawn to your work at Neurokinetics, Dr. Philippe, is the work and the type of therapy that you conduct on your patients now being replicated by others in other parts of the world, or is Neurokinetics still a one-of-a-kind?
At this point, we are still one of the kind worldwide. We have been invited by some universities to work on initiating some training curricula and courses in medical schools and faculties of medicine to integrate that in a current amount of medical knowledge. Yeah.
So, universities around the world want Philippe to participate in developing curriculum. The space agency wants to go to build a hospital on the moon, and eventually to Mars. The guys, to say the very least, JC, at the very tip of the spear when it comes to this whole business.
I would say cutting edge. I would say cutting edge, Sterling.
Yeah. Interesting stuff. Neurokinetics.com, by the way, is the website. Just a terrific way to have a look at the type of work that Dr. Philippe and his team, including Sonia and JC and others, do down there at Neurokinetics Clinic, which, by the way, again, by way of reminding you, is in the Highcroft Medical Building, right there just on your way up the hill heading out of town on Granville Street. Granville at 16th, 3195 to be precise. And again, online at neurokinetics.com. Well, terrific hour. Thank all three of you. Thanks, Sonia and Philippe and JC for a terrific visit. And, well, I guess space is the next step, isn't it?
It is.
See you next time right here on Boomer Life. Have a great day.